All right, so welcome to the healthcare system of the Netherlands. Some cultural things to consider first that are kind of unique to the Netherlands. In this country, the physicians are non-interventionists. They don't give out antibiotics, antidepressants, or narcotics very lightly. They have a go home and rest method of care, where they believe your body will heal itself with rest and home care instead of medication. It is very common for the women in the Netherlands to have at-home births. They believe that birth should be a natural and a sacred thing. Epidurals aren't usually given, and if they are, it's not very common. Even though we may think that at-home births are more unsafe, they actually have a lower infant mortality rate than in the United States. They also believe that death should be a personal choice in life. For instance, if someone has cancer, they can choose to be injected with a lethal dose of medicine to kill them instead of going through painful treatments. This is a result, all these things are a result of culture in the Netherlands being a little bit different than in the United States. The United States, we're focused on capitalism and professionalism and quick fixes, and in the Netherlands, it's not quite the same. As far as the economy in the Netherlands, they have a much more prosperous economy due to their foreign trade system. Even though they're a smaller country, they have one of the best trade systems. They're also one of the most developed countries as far as industry and agricultural productivity goes. As part of their economy, the Netherlands' healthcare expenditures are at 12%, where the United States, we sit at 17.4%. This means that they're spending less money on their healthcare system, yet still seem to have a better healthcare system than we do, where we spend a lot more money and have a less successful and effective healthcare system. As far as health insurance and healthcare plans in the Netherlands, health insurance is mandatory for everyone, and people found without health insurance will be fined. Even people who come to visit have to have some sort of temporary health insurance at the very, very basic. If you're over 18, you must get your own insurance, at least for primary care, and if you're under 18, you're covered by your parents' premiums. Two basic forms of insurance that everyone gets that are insured through the government. One is for basic primary care, and the other is for long-term nursing care in hospitals. Neither of them really cover cosmetic-type surgeries and procedures like that, but you can buy insurances for those separately. A big thing that is really good about their healthcare plans is that it is actually illegal for insurance companies to refuse someone of their rights to have insurance because of age or any pre-existing conditions. Also, if you're a student and are unemployed, you get free insurance under the European health insurance card. And students who do work are offered insurance at low rates and premiums. There isn't an insurance for low-income families or persons, however, meaning they don't really have a Medicaid type system. However, if you do qualify as low income, you can receive tax credits, which actually help pay for your insurance. Also, everyone with the same insurance policy pays the same premium, and there aren't any differences based on income or other medical factors. Alright, so financing of healthcare. Everyone pays a flat rate premium in the Netherlands to the insurance of his or her choice. In 2009, the average premium rate was €1,065. This accounts for 50% of the healthcare funding. Income-dependent employers also make a contribution. It is deducted from the payroll, typically about 6.5% of the taxable income, and assigned to the health insurance fund. From there, the funds are allocated between the insurers based on a risk adjustment system. Healthcare benefits. The basic package is the minimum insurers must provide, and it's set by the government. Healthcare essentials in this package include medical care that includes general practitioners' appointments, hospital care, and prescribed specialist care. Dentistry for those under 18, specialist dentistry, and dentures for those over 18. Ambulance services, postnatal care, and midwifery services. Certain medications, rehab care, and programs to help people quit smoking. In order to ensure universal health care, there are some conditions. Everyone has to purchase at least the basic package, otherwise pay a fine of 130% of the premium. An open enrollment system is in place so that the insurer cannot deny an applicant to refuse coverage. For those who qualify under low income, they receive tax credit to make the basic package more affordable. So there isn't Medicaid, but there's systems in place to help those that can't necessarily afford the insurance packages. People also have the option of purchasing supplemental insurance. This would cover services not included in the basic package. However, since this package is voluntary, The supplemental insurance is voluntary. There's no tax credit for supplemental insurance, and insurers have the freedom to refuse this insurance and these risk select applicants. The primary care system. Every person is required to have a primary care provider who acts as a gatekeeper. On average, a primary care provider sees about 30 patients a day and has 12 consultations over the phone. The primary care provider is responsible for keeping costs low by limiting referrals. In order to see a specialist, a patient has to get a referral from a PCP. The exception in this is cases like trauma and heart attacks. Senior care in the Netherlands. In about 50 years, the percentage of the world population aged 60 and up will be doubled what it is now. One of the first worldly issues that may come to mind when bringing up that statistic is healthcare for seniors. Within the next 5 years, it is estimated that around 38% of the Dutch labor force will be 65 years and older. Considering this statistic, you would only imagine that chronic illnesses will rise, making availability, affordability, and quality healthcare even more essential in the years to come. Of all the healthcare systems in the entire world, the Netherlands happens to be one of the best for elder citizens and retirement options. In 2011, Australia's Melbourne Mercer Global Pension Index rated the Netherlands as the number one retirement income system across the globe. The top reason leading to this prestigious rank is that elderly in the Netherlands receive a flat rate public pension just for retiring, and not to mention they also receive Social Security-like pension based on lifetime earnings. When it comes to veterans care in the Netherlands, Veterans Institute was established in 2000, and this opened doors for healthcare to war veterans of the Netherlands. Dutch war veterans and family members are provided with premium care and services through this institute. A program called the Veterans Window entitles access to health care such as the Ministry of Defense, the Veterans Institute, the National Health System for Veterans, the APB Pension Fund, and the Veterans Platform. The Veterans Locket, which is in Dutch translation it means Veterans Desk, is an organization that is easily accessible for Dutch veterans to seek permanent mental or physical care along with their family. Such care includes specialized social work, primary and secondary mental health care, pensions, benefits, rehabilitation, and integration programs. Some characteristics that are unique to the Netherlands. One answer the Netherlands government has to the ongoing issues of healthcare in our world is the eHealth Initiative. The most frequently mentioned reason the eHealth Initiative was created was the issue of population aging. In September of 2008, the Dutch came up with the electronic health record in an effort to become more patient-focused and incorporate health information through technology. The eHealth system was started for the use of processing massive amounts of information. This helps keep things organized and just helps cut down on the frustration that a lot of patients can have with paperwork being lost and misplaced and things like that. The initiative primarily intends on making the public health administration of the Netherlands more trustworthy and proactive.